Most persons with disabilities in Uganda are very vulnerable and poor due to a number of factors like lack of relevant survival skills, employment, and low self-esteem, mentioned but a few. Those who struggle to get work are in most cases either discriminated at work due to their disabilities or at times find it difficult to cope up with the working environment due to lack of reasonable accommodation like accessibility and sign language interpreters. The case is even worse for girls and women with disabilities as their parents or guardians invest less in their future but subject them to early marriages, thus living a very miserable life. Everyone in life works hard, day and night, to have a better standard of living or livelihoods at household level, and this is not exceptional to PWDs. However, PWDs in Uganda have remained in the poverty line for decades, despite a number of livelihood government and non-governmental programs at different levels, and the golden question is, why? Although the policy environment in Uganda guarantees effective participation and inclusion of PWDs in development programs in a human rights approach, this has remained more on paper and less has lived the reality of disability community, thus subjecting PWDs as dependents to others. Therefore, if Uganda is to achieve the dream of middle-income status by 2040, vulnerable populations like PWDs must be effectively involved and included in all sectors of growth. The time is now to learn, unlearn, and relearn the sustainable strategies of inclusion of PWDs in the development process in an effort of promoting the SDG slogan of "Leave no one behind." Although the government has a sole mandate of ensuring the above, several DPOs like NUDIP, UNAP, Light for the World, Mental Health Uganda, UPID, UNAC, UNAD, ESAO, and UNAPID, through a livelihood caucus, has intensified efforts of engaging government and other mainstream livelihood players to ensure inclusion of PWDs in different programs. The efforts of different DPOs through their inclusive livelihood caucus has had positive impacts on the lives of several PWDs, as highlighted below.
The stigma is not only to women with disability, it starts with a woman. And being a woman with disabilities, it was worse. Because those days even the community was not yet sensitized about about disability, let me say. Because you could begin moving on the road. People begin calling themselves, you come, you see, this one who is walking with the stick. So you feel very small. So that one could create a fear within ourselves. But through those trainings, several trainings which we got from Voodoo and other our organizations up there at the national level, that things disappeared. That's why I am talking right now without no fear at all. I'm expressing my point very well because of those trainings which we received. I stand without no fear at all.
Dream of starting a business from streets, clothes, and retail business. Sheep rearing. Efficient and manageable poverty reduction programs go a long way in improving the livelihoods of families of persons with disability.
Amanya gange nze naga Christine wandise bigere. Ndi mutuze wenna mawojjala bwefulumya. Nkunganira mu group y'erugazi eyitibwa Persons with Disability Rugazi Group. Group eyo njiyingira waliwo omwami bamuyita Teacher Emma. Yajja anoonya abaliko obulemu abatawulira n'asisinkana omusumba bamuyita Bonex Mahoha n'amawojjolo. N'amugamba nsaba onnoonyezeeko ku bantu nga bwe bati abalina obulemu ku mubiri gyabwe. Eyo omusumba yali amumanyi n'ajja n'aŋŋamba nti tulina gurupu egenda otandika waffe wali ku church. Kati ne tumiitinganga kati ekyavaamu era oyo omusumba n'ajja n'aŋŋamba ekitongole kya UNACA waliwo abantu be beetaaga okwongeramu ko capital ate gwe ng'engeri gy'olinaawo ka bizinesi basobola okwongeramuuko naye nga mugenda miitinga lugazi. Yes, ngenda kati ne bandagira ne tumiitinga ng'elugazi awo ku St. Paulo. Ne tumiitinga awo twaliyo ne Christine wa UNAC n'abalala. Kati ne twasomera ennaku 2 ne batuwako capital ne nzija ne nyongerako mu bizinesi yange. Bizinesi yali ya mukene na binyeebwa na nnyaanya. Kati ne nyongeramu obutungulu n'engula ne buto naye olw'embeera nti teyatambula bulungi buto bamulinyisa bbeeyi. Kati n'ensooka ne muwumuzaamuko ye n'engulako ne mutambuza ddembe. Essaawa zino ndi musanyufu olw'ekibiina kya UNAC kubanga kati manyi nange ndi muntu nga bannange. Nange nsobola okubeera mu community obanga aliwoko ekyetaagisa kye bayisa abantu nenyimirira nange nenjogera.
Olina kyoyagala? Wandise. Kale ssebo, okufuna ekirooto ekitandika bizinensi natandikira ddala kuviira mu ssomero nga ndaba abaana abaliko obulemu kwegamba batuyisa bubi nga tubeera mu bannaffe bano abaliko obulemu naye nga batulaba bubi kwegamba tebatufaako. Ne ngamba kati singa ngenda ku mulimu kiba kitya. Kati ne ntandika okugamba nina okwefunira omulimu gwange gwenkola ki gwe neekolera. Kati yali maama eyampa capital yatandika ki bizinesi. Engeri gye yali nti akola mu retail shop nga atufunira yalina sweet gwe yatuwa buli muntu ne ba brother bange. Nangamba sweet yo njagala mumutunde nga ofunamu sente ezisuubula nga ye azifuna n'azisigaza. Kati ffe nga tusigaza ki amagoba. Bwe natuuka mu vaaka ya P7 ne ngamba sente zino ze tukuŋŋaanyiza zikola ki zimala. Lwaki sigezaako gaziya ki okukola ekintu ekirala. Kati ne ŋŋenda mu kibuga okusuubula engoye. Kati mu kusuubula engoye ne nfuna emikwano abo be nasuubulangamu ne batandika okumpa engoye ne ndeetanga nenkola ki nentunda naye ng'ate nkolera wa maama naye sirina we nkolera. Kati mu kuba nti nali nkolera awo wa maama kati bizinensi yange netandika okujja ng'egaziwa engeri gye balinga bampa ebintu ng'ate nfuba okukuŋŋaanya profits. Kati nentandika okusasula abo abalinga bampa ebintu ne mbamalayo ne ŋŋamba lwaki sifuna ekifo wenkolera bizinensi yange nga ndaba ebintu bye nnina bigenda kumalako maama emirembe. Nensuka n'ebintu byange nenzija wano okukola boutique. Nali naakatandika myezi nga2 covid najja. Kati covid bwe yajja ne ŋŋamba nalinako ne knowledge ebeera mu retail shop. Lwaki sitandika retail business? Ne ntandika mpola n'obuntuntu era obutono bunzaali biki ebyo byonna bunzaali bubiriiti. Ne ntandika okucoming up n'ekintu ekinene nga nzija nkola ki nyongerako benkyo nyongerako mpola benkyo. Nalina omusomo gwe nagendako naye omusomo ogwo gwatuyigiriza okwekkiririzaamu nga nina okwekkiririzaamu nsobole okukola ki okukola bizinensi eno nga sifaayo oba ani agikoze oba ndiko obulemu oba siriiko obulemu. Ne ŋŋamba nina okwekkiririzaamu era nina okukola bizinensi eno.
God came to answer our prayers. We got funds that was about 3 million which were given to our group. We are about 15 members, and from the funds we accessed, each one got a sheep, and then we had 3 male sheep. This sheep help us, the members, and it even helps the community. Like you can run short of school fees for a child, at least when you have one, the young one you can sell and then leave the big one at least, so that you keep on going. You sell that one, you add some money, you pay school fees.
In the early years, persons with disabilities were excluded from participating in public activities which would help them get income. The inadequate social and economic structures in place are geared towards fixing persons with disabilities, yet organized training can go a long way in strengthening their capacity to live independent and fulfilling lives. Documenting their livelihood experiences and illuminating their struggle to secure a better future for them and their families is a start.
Baleetanga emisomo nga gijja direct muffe. Ne batubuulira abantu bano temubasosola, temubaboola, temulina kye mugenda kuba. Kati kyatuyamba nnyo okubeera nga naffe bo bennyini nga bekkiririzaamu era abantu abo tebeesaasira basobola okukola. Kati mu kusobola okukola ebitongole ebyo byatuyamba ne bituyunga ku disitulikiti ne bituyunga ku town council ewa CDO. Era katumaze okweronda mu gurupu twafuna essente okuva ewa CDO ku town council. Ne tugula embizzi. Twatunulanga ze zijja okusobola okutuyamba okusinziira ku kitundu mwe tuli n'okusinziira ku balwadde baffe ng'omuntu ne bw'aba mwana ne bw'aba muntu mukulu bw'omuwa ekyana ky'embizzi agenda n'alunda n'ezaala n'asobola okwejjanjaba. Oba transport bwakunona mpeka abuze asobola okutunda ekyana ky'embizzi ekyo ekizaaliddwa so ssenkulu n'asobola okufuna eddagala n'alema okubeerawo ng'akaaba. Ekitongole kye kyasinga okwagala bejjemu babeere nga bakimanyi nti nange nina okubaako kye nsobola. Ekyo ekitongole tukyebaza nti kyakitukolera. Tuli bammemba 25. Ku bammemba 25 waakiri 2 gamaze buli muntu okufuna embizzi kubanga ng'ekitongole kimaze nga tumaze okujja ssente wa CDO twateeka wamu embizzi zaffe ne zizaala nga mulimu ennume n'enkazi. Kati nga bwe zizaala eyo luutu bano ne bazitwala ate luutu eddako abalala ne batwala.
We were given funds by UNAPID and we supplied 20 piglets to our beneficiaries in Gomba. When we were giving out these piglets, we tagged them. We thought that sometimes our people can be funny, and we're like, okay, when we give you this, it's not free of charge. We want you to grow it, and in the future you give it to the next person. Because the 20 people in Gomba is very little. It's a drop in an ocean for people with epilepsy. Yeah, so we have been able to replace all those that died, and hopefully this year we are thinking of going back to redistribute to the next beneficiaries. When we gave them piglets, we realized that they owned them. They say they give us reports that they own and they want really to look after their own pigs in their condition. And indeed it gives them hope for tomorrow. And these pigs have multiplied and they are getting some income out of it.
The tremendous engagement by families in the training offered by DPOs, NGOs, CSOs opens their eyes to different opportunities. Children with disabilities who were hidden away are now happier and aware of their environment.
Okusooka mu kyalo muno twasooka twafuna bamweta Kalamu George. Kalamu George yatukoba tutandika okufuminga group nga amaze tukoba nti waliwo ekitongole ekiyamba abaana abalina obukosefu. Kati twakola ekyo twamala okukifuminga twagemagana naye yankoba nti ndikwenda onsolokeza abazaire abalina abaana abalina obukosefu n'abafuna. Twakola naye program twayagana nakwigombola yatusomesa twafuna n'abagenyi abandi okuva e Kampala era bona beda twasingana nabo kwigombola babona ku baana babona ku bazaire batandika okusomesa abazaire engeri y'okugemamu abaana bano kubanga abaana baife waka balinga abamu basiba munumba abamu babona ku banaibwe balumukira miyandu So abasomesa bajja nga batusomesa ebintu ebyo batandika okola organisation batandika nga kulambula abantu abo kiseera bwe kyatuuka kale mujjo gyalekobatikwatibega nti kwenda okuboneka nga abaana bano bakola ki bavaayo batusomesa emirimu gye tulina obakolamu era twafaayo ino okuba nga tusisinkana abazaire twabona ni ku baana batandika okukola puroguramu twaidde namwendwa so twajja okubona nga abaana bwe twatandika nabo nga w'omu etasooka yakulingira yagenda akola ki kulumuka olwo olunaku eyo nga tuli ku ntandiikwa olw'okuba nti baiti batwidi nga babona abantu balumuka.
Nebaza ekitongole kya UPD kyebale bwe kyayida nikitugemeraku ku abaana baife baali beetya nga mu banaibwe tibasemberamu nga bavumibwa era bakubibwa aye nebaza ekibiina kino bwe kyatugemaku saawa eno taape tiyeetya asobola okwogera ku basaawa eno bwatira okwemba ayemba ni mu kanisa asaba yayemba nebaza ekibiina kino engeri gye kitulezeemu kyokka mwebale kutulera kuba naye tusuubira nga Katonda ayinza okola ekyamagero omwana wange eno saawa eno okuba omukosefu naafuna embuzi yena n'atandika okubalibwa mu bantu ate ate bwe tiyaterera era yeeyogerera okwozaayoza okudubaadubaku okunaaza ebintu okugya amaadi buli mulimu gwakola.
Nebaza ekitongole kya UPD ekyayida nikigema ku baana baife nikibatoola we baali bali nga beetya mu banaibwe embeera ya Silivia saawa eno buti tiyeetya mu baine
abaana ani batandika nga nze wange era muwe embuzi edo tina muwe embuzi ye yatwalaku yayaya mbuti yena alina isuubi era yabayaba alina isuubi nti alina ekintu kye bwe yatuuka buti saawa eno buti yerookeza mwene kyayenda ekitaaliwo wale.
When income generation projects are in place, there will be increased employment opportunities for persons with disabilities. Boosting their employability through training improves their livelihood.
Ekitebe kyaitu kinu kikatandika 98 ubwo tukatandika tuli batuyito muno tuijaga ntu meeting aitwenka tuloho batoyito baitu twagenda ntukurakurana kiro kimu nudipu neijaga netubungiraho na nuwudu neijaga netubungiraho kale nibatuweta ntugenda no workshops Kampala nitugenda mu workshops nitwegaya amagezi tugarulira abagenzi baitu kuno kyonka ati tubantu tulao ntulobingaga ati tuine byalani 8 abaana bayingi tibikutumara nabyo tukaikara twagamba naitwe twemigire mu myoga batuhaye sente tuinaho saako yaitwa municipal ati musaako omwo tugenda ntwehorayo sente ntuteeka mu association yaitu naye kukora aho no tuli.
Since family is a very important foundation for any child, training parents and caretakers to support PWDs increase their chances of survival and decent livelihood.
I'm a patient. They did that to me. That's why I'm here talking to you as I am. Medically, counseling, and attention from my caregivers, relatives, and friends. So, personally, I would say if such would be given to mentally ill patients, things would be different. As a chairperson in Lira District, I have a hope that if only we could have chances of having people to stand with us and we give such care to our patients, things would be different, as it has been different for me. But single-handed, I cannot do it as a chairperson. We work as a team in Lira District. We give counseling, because some time back we were given counseling trainings. So we have sessions as a team. We go and meet our patients in medical camps we have organized. We give medical treatment, we give counseling, and some health talks. It's helping a lot.
Medical camps, we go out to communities, we educate them, public health talks. This is a project that we've on a large scale been partnering with Lira Regional Referral Hospital Mental Unit. Yeah. We go out to the field with them, reach out to communities, to our peer support groups. We have about 4. We go out to these community groups, we give them public health talks, we assess them, medical assessments, we do psychosocial assessments together with the psychiatric clinical officer. We give them drugs. For the new people, we give them drugs. For the old people, we refill. We refill their drugs. We put them on a treatment plan. We counsel them. We see how they're taking their drugs. Are they following the treatment plan? Are they living healthy lives?
So the time I went for treatment, I got sharp person there. She advised me so that I am supposed to join the group. And she was trying to tell us that there is a support and other organizations can support us with. And then I say, okay, if it's like that, let me join. And by that time I joined them, and those support came and they support us with the goats. So those goats, I'm having them now. Even others, I sold it for paying school fees for my children. Others is still remaining with me together. I think that that remaining one will take me for another solution, such as buying cows and helping me buying tablets for sickness.
Most of our members, basically the patients, persons affected with mental illness, we give them goats. If the person is stable, he will take care of the goats by himself. But if he's not stable, we have a category of membership called caregiver. The caregiver will take care of the goat within the family setting of the patient. The reason why we started this project was to help our patients access drugs, increase access to basic needs. So to increase their capacity to manage their own health issues at home, we said we should bring in this project. If you look at one of our model farmers, we gave him 1 goat, and with time it increased. This is a man who now has more than 2 bulls for plowing. It helps him generate money. His wife is now into what? Into business. He can take care of his family.
Access to livelihood skills building is a necessary step to the economic empowerment of the marginalized PWDs. When they participate in their growth, there is evidence that they will live long and healthy lives.
It has helped us so much because during the initial times when the groups had started, we had to go through routine trainings. But as years kept on going up, you find that there was no need for more help, because you find that even one group can transact its business from the beginning up to the end of the end of their business. So when at times we just go to check through what they have done, but you find that everything is in line with what they were taught. So you find that even there are no grudges. There is respect for each and every person, and they keep on following the rules that were put in place at the beginning. As you come, 1, you keep time. So at that time, you will find them there. 2, you make a circle, a ring circle, as you are starting to save, the same. No talking. So you find that there is respect for every person, and every idea is taken. If there is any problem, they do report to the office, and we also take action. We see if there is a defaulter, we see on how to recover that the money, and everything is put in place.
The mental health Uganda came and taught us, and people like people from Global Institute, they came and empowered us. You know, knowledge is power. So through their knowledge and all that, we were able to understand many things and begin to put in place what we what could help some of our friends.
Nuodu, site savers, na nudipu. Nibaija nibatuegesa nibatuihayo nibatuihamu inye mugambe kizikiza ekikaba kitulimu omutima muno kandi kumanya trainings zatuyambire abana baitu batandikire kusoma nibajora na madiguri.
We should not ignore the role of education in addressing poverty and unemployment. Sustained and inclusive training for persons with disabilities provides long solution for all.
Let me take an example of our hands-on skills. We've trained most of our members. I personally can make liquid soap. Some of them have been put into sewing machines, tailoring. You find that this girl who has been taught tailoring, she can command herself. Yeah? She can get whatever she wants. She feels she's a woman. Yeah? She can plait her hair, dress up, So the way she'll act in society before, she'll command respect. Even the way she's talking. Most of our members are now empowered. They're empowered, they can talk for themselves, they can access their drugs, their basic needs. So basically, hands-on skill, I think it's the biggest weapon we've used to instill self-esteem in our members.
In order to increase the opportunities of persons with disabilities to make a decent living, there is a need for future training in self-awareness to make them self-reliant and efficient.
I pray that maybe with the time, if we could be helped to put up a rehabilitation center, we'll take responsibility of our friends that are loitering. And also our biggest challenge is, some people have left normal women and turned onto our girls and onto those who are already patient, they're going to abuse them. And we would pray that we put up a rehabilitation center and possibly an outreach into the communities. You see, people say prevention is better than cure. If we could maybe help to reach the community so that we talk to people before they become mentally sick. And we have learned that treating a mentally ill person in a facility like the hospital is very expensive. But I believe prevention is much better.
Engeri abaana bano gye bali nti abamu baagaana nga baali basoma naye olw'embeera dhaibwe bamala baira waka. Wainuma twatulemu okusaba kusinza ku mbeera nga tuli kusaba eisomero we tube tukungaanize nga abaana abo tubateemu amagezi oba oli abasobola okuviira nga abo bajje mu masomero agaani. Twateremu okusaba okwongera nongera okusaba singa wabangawo okutupulaningira era nga nsaba mutupulaaningire tusobola okufuna isomero tukungaanizaamu abaana abo kuba mpegano bwe mbanga mubaire nabo mubanga mubatoolayo ajja okujeere mubaine nga tasobola ng'aza mu kutya konakona. So mpegano tusaba yabangayo obuyambi bwonna era nga tusaba obuyambi batuyambe okubamu nabo okukigemukana n'essomero.
I still thank God that I'm a patient, because without that I wouldn't be doing this to my fellow people in Lira and Uganda at large as a board member national level.
Work gives PWDs a sense of purpose, security, and is a source of income, and that is why it is important for NGOs, companies, and microcredit organizations to offer inclusive and accessible services to persons with disabilities so they can set up their own business or maintain them.
Singa abaliko obulemu bakeera ku makya ne bagamba nti ono tugeramu wala akakadde kamu naye ssente zino zigenda kuddayo mu bbanga beeriti. Kati nganze akola mu business nsobola okugamba nti buli mwezi nsaving emitwalo oba 5 oba 10 ne bwe mbasizaayo magoba sobola okukola ki okwegamba okyepimira ne mba nga nzizaayo ki ssente ezo. Kwegamba ne mugezaako at least oba okuprovidinga ekyo kati nga bwe nkugambye neetaaga fridge namwe musobola okugamba baliko obulemu katuba designingireyo akantu tubagabireko ku bintu bye beetaaga. Bw'osanga atunga engato n'ogamba ono atunga engato bwe tumwongoleramu ssoole wano kikola kitya? Bwe tumuwa eddagala lirikuba engato kijja kuba kitya?
We still requested some support from the government of Uganda and even the NGOs and the disabled bodies in Uganda. They give us support so that at least we came up to a stage whereby we can access a lot of things that we need. We shall be able to take our children to school as others also. We shall be able to get something that we can eat. We can be able even to hire gardens where we can grow our crops, and then or even we can use that as a support in agriculture. It gives us support whereby we can hire somebody, goes to the garden, at least cultivates, and we shall also have food so that we shall also live like other people.
Kirowoozo kyange ndowooza kugaziya bizinensi eno ndifuula essomero nga nsomesa abantu abo. Ne bw'aba afunye obuzibu mmanyi ekyokukola. Tugeze bwe babeera wano ne banne bali wano singa olumbe lubeera luzze tutuggalawo obuggazi awo nga twetereeza eno munda. Tetusasamaza kitundu. So bwe lumukuba eri ebbali oba bw'anaagenda mu masomero ag'enjawulo gye batamumanyi banne bajja kumudduka. Kuba wange kye kyamujja mu ssomero. Kale kyannuma era kyensinga okwetaaga kufuna ssomero. Kugaziya pulojekiti eno abaana abo mbeere nga mbakuŋŋaanya. Si muwala si mulenzi mpulira nga ndi wiringi okubeera nabo. Mukama bw'aba nsobozesezza.
The project is coming to end by end of June as the first phase. It has been a 2.5 years project, and by end of June it will be coming to an end. And I think, as you already mentioned, that when you've been going to different areas of the districts, you've engaged different members of this project, different members, beneficiaries, different disabilities have got a benefit from this project, and most of them are saying, what's next? It has been a good project. Street has been a good project, but all of us, we know advocacy is a continuous effort. When you do advocacy work, it's not something you can achieve tomorrow in 2 years and say, yes, I've really achieved my target. It's continuous. You achieve, but you have to continue engaging. So because of that, we are trying to engage our partners who have been funding this first phase of the project to renew it for maybe another 2 years. And we hope that they'll listen to our crying and we have another intervention to continue further for another 2 years of this project. That we want to see persons with disabilities if they get out of the poverty line. We are tired of being looked at as part of the poor. We are tired of being categorized as living below the poverty line among other vulnerable populations. So we are trying to put that advocacy efforts, that fight, to see that let's first improve the pocket of a disabled person. That when the pocket is okay, then he's able to go and advocate for another right. People have been telling us that you cannot go out to do advocacy work when at home there's no food. When the pocket is not having a single coin. Because of that notion, we decide first to improve the pocket of the person with disabilities, that they are comfortable at home, they have a source of living, then we can comfortably go and advocate for something else. So looking towards this extension, maybe for another 2 years, God willing, we'll let you know when that one also succeeds.
Me, I would really appeal to UNAPID and more probably DHF, which gave us this funding, to give us a second chance, a second phase, I could call it, such that those who are not able to access this funding can also benefit from it, but most especially to make sure that in this current situation of the pandemic, people with disabilities are being catered for. That is what I would think.
This caucus of livelihood, which I'm talking about here, that's where we have a number of DPOs coming together. UNAPID could be for physical, UNAB is for the blind, UNAD is for the deaf. UNAD, when UNAD comes into this caucus, comes the experience of handling their blind people. When UNAD comes into this caucus, comes the experience of handling the deaf people. The same to SAO comes with those who are handling people with epilepsy. So we have specialties of different disabilities, of different people who can handle self-esteem of different members. And that resource comes together into one pool. And we handle self-esteem as a pool, as a caucus. So when it comes together, we're able to handle collectively the self-esteem of respective members, all with the aim of advocating for inclusive levels of everyone into the mainstream sector.